Hello everyone, Dr. Kimball here, and I'm going to spend a little time talking to you about why did my surgeon recommend a spinal fusion for me. In my experience, in my opinion, there are really three good reasons to consider doing a spinal fusion. Okay, number one, if you have a fracture or instability that is putting your spine at risk for injury, that's a good reason to consider doing a fusion. Basically stabilizing the bones in the spine so that they're not going to be putting at risk the nerves or the spinal cord. Now, if you're watching this video, it's probably unlikely that you have a fracture that is unstable. Most people that have that condition present to an emergency room, and they're not going to be spending time searching around for whether or not or why do I need a fusion. Okay, so the other two valid reasons for having a fusion in really the larger population is one, if you have an unstable spine, and that is kind of similar to fracture, but you can develop instability of your spine when you just have degeneration of your spine, and that instability or slippage of the spine can cause the nerves to be pinched, and it can also cause back pain. And if you don't fix that slippage of the spine, which the word that we use to describe that is spondylolisthesis, or spondy. If you don't fix that, then doing some sort of procedure to decompress the nerves is only going to make that worse. So you have to prevent the bones from moving, and that process of preventing the bones from moving can involve rods, screws, bone grafting, and ultimately the fusion is where the bone grows across where a normal joint was and it no longer moves. So that's one instance if you have a spondylolisthesis. Okay? The other very, very valid reason to consider doing a fusion is if you have some sort of deformity of the spine. Now, what do you mean by deformity? Deformity is a word that we use in medicine or in surgery and in spine surgery to describe any sort of angulation of the spine that is abnormal, that has been created not just by muscular or tendon laxity or even muscle over constriction on one side. A true deformity of the spine may also be referred to as a scoliosis. And so you can get a scoliosis in the neck, you can get a scoliosis in the low back. A classic type of neck deformity would be something where you're looking down and you can't pick your head up. And we call that a chin to chest deformity. That's super severe. Some people will develop in their low back real kyphotic or angulation of the spine leaning forward. That can cause a lot of pain, and it can cause other problems like even difficulty breathing or difficulty walking. Sometimes you might see someone that has, a bump on their back or a hunch on their back, and that type of deformity may be a curve to the spine or a real scoliosis. Now, what I will tell you is that not every curve in the spine needs to or should be fixed. When the curve becomes problematic and prevents function or intractable pain or nerve impingement, which all those things can happen, then correcting and reconstructing the spine through a multi-level fusion procedure, that's a really big procedure, but that can be very helpful, and there's a lot of good scientific data saying that yes, that's a really good way to treat it. So not all fusion procedures are bad, and if you are being recommended a fusion for one of those reasons, then there's a good chance that your doctor is following good evidence-based guidelines. Now, there is a real gray area, a gray zone, where patients that have stenosis of the spine are also being recommended fusions. Now, that is a very gray zone, and you might actually get an opinion from one doctor telling you that you need a 2-3 level fusion in your low back, and then you could go to another doctor that is less aggressive on fusion and may only recommend a multi-level laminectomy or decompression. The difference between those two procedures is substantial. The laminectomy or the decompression alone could take a couple hours, and you could be out of the hospital or surgery center within a couple of hours. On the other hand, a multi-level fusion and laminectomy, which is a lot more surgery, a lot more risk, of infection, nerve injury, spinal fluid leak, time on the operating room table, and all the other risks associated, including infection and even just anesthesia, risk of pulmonary compromise, etc. All those things, risks are going to be substantially higher. Not only that, but a multi-level fusion, you're going to have a lot longer time to recover. Really what you will be recovering from will be the trauma that's occurred to the muscles in the low back or other part of the body that was accessed to perform the fusion. Remember, that could be done through the stomach, also sometimes through the side. So those are different methods of approaching to do that fusion. And you're going to have to recover from that. That's a longer process. Aside from the recovery of the tissue trauma is now the bones actually have to heal. And you actually have to grow new bone. Remember, the fusion is growing new bone across where a normal joint was, or in your case, possibly a very degenerative joint. And so that can take 4 to 6 months at the earliest in most cases. Some people won't even consider a fusion to be complete up to 12 months. And most of the time we verify that via a CT scan unless the x-rays are showing it really well. So those are a little bit about why someone might indicate a fusion. Now you might ask me, well, if I only need a laminectomy, why is my surgeon recommending me a fusion? And I can't always answer that. Sometimes the doctor might feel compelled that he cannot get a good enough decompression or laminectomy done without removing too much of the normal anatomy, the normal joint. Now I've got a little model of the spine. This is the posterior facet joint in the spine, and it can become arthritic and cause stenosis or compression of the nerves. One of the jobs of the surgeon when treating someone that has stenosis is to shave that down and make room for the nerves. I was referred a patient by a family member recently in another state. They just wanted me to look at the films. I looked at the films and there was a couple levels of stenosis. This is like a 70-year-old man. He's having leg symptoms. I looked at the films and immediately didn't see any deformity, didn't see any slippage of the vertebrae, and thought, wow, this patient could do well with a 2 or 3 level laminectomy, and that could potentially be done in an outpatient setting. This patient was recommended an L2 to S1 fusion, so that's L2, 3, 3, 4, 4, 5, 5, 1. That's a 4-level fusion, means rods and screws. 4-level fusion includes 5 sets of screws, so that's 10 screws and 2 long rods, and probably a surgery that's going to take anywhere between, at minimum, 3 to 6 or 7 hours. That's a big surgery. That's a lot to go through, especially if you're 70 years of age. So why is that surgeon recommending a 4-level laminectomy and fusion? And why would Dr. Kimball consider just doing a laminectomy? My experience is that the goals and outcomes from the surgery really need to be geared toward the patient. And it may be possible that that surgeon is not confident or comfortable that they're capable technically to get the nerves as decompressed as they need to, that they feel that they have to fuse the bones in order to get that much, make enough space for the nerves. I feel very confident that in most of these cases that a laminectomy that could even be done in a minimally invasive fashion through a small incision can help you, well, the surgeon can achieve the desired result without doing all this other stuff. We won't get into the other problems or challenges associated with fusion, but this is just a very simple example. I see it all the time. And so if you're recommended a fusion, let alone a multi-level fusion, ask those 2 questions. Again, you're probably not in a hospital somewhere from a car wreck if you're watching this video. So do I have slippage of my vertebrae? Do I have some sort of deformity or scoliosis that you're trying to treat? If not, why are you recommending me a fusion? Is there any way that you could fix my problem without performing a multi-level fusion? That's really the question that you should be posing to your surgeon. Hopefully you found this video helpful. If you did, please click like. If you have any comments, I'd really welcome those. I'm looking for more topics all the time that are going to be helpful for you, and I'd be happy to answer your questions through that. If you have more questions that you'd like, or even consider having a second opinion about, or an image review of your films, your MRI scan, please reach out to me. I'm happy to review those films. I've got a free web-based image viewer that I can send to you, and you're welcome to send those, and we can review them together. Thanks so much.